We turn now to Admiral Brett Giroir. He's a medical director and assistant secretary for the health at the Department of Health and Human Services and a key member of the White House's coronavirus task force. Admiral, good morning to you. I guess they call you the testing czar for short as well.
Good morning.
Good morning. So the Surgeon General this week said this was going to be our 9/11, our Pearl Harbor. He said it was going to be the hardest and saddest week of most Americans' lives. Dr. Fauci said it would be shocking and disturbing. What should we be braced for as Americans?
Both the Surgeon General and Dr. Fauci are, of course, right. And all our predictions, all our models, and we know from the data that we see and the healthcare workers we talk to is for New York and New Jersey and Detroit, this week is going to be the peak week. Now, remember, this is the peak week for hospitalizations and, of course, for deaths. This reflects infections that occurred 2 or even 3 weeks ago. So we may be seeing the worst upon us right now in terms of the outcomes, but that still could be consistent, and we believe we're turning in the corner because of all of the physical distancing that we're doing. Other cities, like New Orleans, will come a little later. So their time is not this week, but they're going to peak a little bit later, and we'll see some rolling peaks across the country as the next few weeks unfold.
That was my question. If you live in a state or you're in a rural area or a smaller town and you think this seems like a big city problem, this is going to be their 9/11, but not mine, other than the obvious point about us all being Americans and in this together. But are these other areas safe, or do you expect the outbreak to reach those areas as well?
No one is immune from this virus. It is a brand new virus. And whether you live in small town America or you live in the Big Apple, everyone is susceptible to this, and everyone needs to follow the precautions that we've laid out. Your best precautions, the best way to avoid this is the physical distancing that we've been talking about now for several weeks. Stay at home. Thank you for working from home and setting that kind of example. Wear a face covering if you're in public, because you could be asymptomatic and spread it to others. So everyone across the country can get this, and it's very, very important. Even though we say this is going to be the peak, if we let our foot off the gas and start doing things that are ill-advised, we could have another peak in a few weeks. So we have to completely keep our efforts going.
And let me ask you quickly about that, because Dr. Birx said on Saturday, I believe, not to even go to the pharmacy or the grocery store. And that goes for not just people in these hotspots, but for everybody. Is that your understanding, that if you don't have to, don't even go to the grocery store or pharmacy? She
is absolutely right, and we're all saying the same thing, is that you really need to keep your physical contact with others and with surfaces to the minimum possible. That does not mean go without medications. If you need to go to the pharmacy to get your medications, if you need to get groceries, do it. But don't go every day to the grocery store like many people do. Do it as infrequently as possible. Do the kind of takeout things. Anything you can do to protect yourself, to avoid yourself from getting this virus and being in the hospital for a month or potentially facing death, I think it's advised to do that.
Let's talk about testing. As I mentioned, you're known as the testing czar. There's an Inspector General report from your agency, the HHS, out just this morning, just a few minutes ago. It found a, quote, severe shortage in testing kits at hospitals. Why is that, and how can you rectify that?
Well, we've done over 1.67 million tests to date, and this week we're going to have at least 1 million tests done, and that's not even counting the thousands of hospital laboratories that do their own tests. So tests have ramped up dramatically in the past couple of weeks. This week we'll have at least 250,000 of the Abbott point-of-care tests out. So this is being remedied, very quickly. Everyone who needs a test can get a test this week. If you're hospitalized, if you're a healthcare worker, if you're elderly and have symptoms, but we're not to the stage where tens of millions of people can get tests. We have probably 1 million or more this week, probably a little more the following week, and entering into the next cycle when the, quote, serologic tests come that understand whether you've had the disease before, that will be available in the tens of millions very soon. That's a different type of test coming in the next few weeks.
Right. Well, it's the HHS said that there is a severe shortage right now. So, I question whether or not it's true that if you need a test, you can get a test. Why is it that the U.S. has so far lagged behind other countries? I mean, if you look at South Korea, you look at Italy, they're testing at a rate essentially double the rate that we're testing.
So we are really going hospital to hospital to try to assure that the tests are available. And I'm meeting with hospital associations from all the Metroplex areas. And there's no question that testing is tight, but there are enough tests out there for people who need the test to get the test. Again, another 1 million+ tests this week, and there are many things we can support hospitals doing to enhance their capability of testing. So I know about what's going on today, what went on last week, and where we're moving into the future. And again, we are not going to have tens of millions of tests this week, but we will have 1 million+ tests, plus all the thousands of hospitals who do their own tests. That should be sufficient to take care of the load we're going to see this week. And then in the future, with the different types of tests, again, we will be in the tens of millions of ranges within a very short period of time. That's where we are today.
Admiral, this is important work you're doing. We thank you for your time and for that work. I appreciate you being with us.
Thank you.